This is Dr. Dylann Germann of Impact Physical Therapy, the owner and also physical therapist. Dylann, how about you tell me a little bit about you and your practice?
Hello, Dr. Rubin. Thank you so much for having me today. So I'm Dr. Dylann, and I'm a physical therapist. I specialize generally in outpatient orthopedics. So we do a lot of evaluations and treatments for individuals, kind of ranging from the lifespan, from like late teens, early adulthood, all the way through. And we specialize in orthopedics. So we take a look at everyone. We look at their musculoskeletal health. We take a look at their neurologic health. We do a super thorough assessment. And I would say that our clinic is a little different than most because this isn't the type of place you just come in, do a very general evaluation, you start kind of doing some exercises with an aid. We really do a much deeper dive. So we take a look at your general full body functional mobility. We will very frequently talk about a lot of systemic things, certain health and risk factors that may also be influencing you. And then we develop a really comprehensive treatment plan. So, whether that's via exercise, whether that's hands-on work, that's one of the things that we really specialize in our office is orthopedic manual therapy. So we do a lot of the hands-on work to improve people's mobility. So we kind of really run the gamut, and we really are a very comprehensive office, very different than a traditional PT office.
That's interesting. Audiologists, physical therapists, we play such an important role in the healthy aging process. Obviously, immobility, lack of independence are big risk factors for cognitive decline. So just take me through your role in the interdisciplinary team to ensure that patients are aging the best they can, especially in terms of cognition.
It's a great question, right? So as individuals kind of help patients maintain and improve their mobility and, recover from injuries and really maximizing that function, you think of a few different things. The number one thing that I think of is muscle strength. So mobility is huge, and we can touch on that in a moment. But really, the most important thing as we get older, there's a term called sarcopenia. So the word sarcopenia means the age-related loss of muscle mass and strength. And after the age of 30, we lose like between 3 and 8% of our muscle mass per decade. And that often accelerates after we're 60. So when we're talking about kind of those latter stages, and as we age more, not only are we a little bit weaker, but we're progressively kind of getting weaker as we continue to age. So for me, the number one thing that you really can do as you're aging is perform regular resistance training. Regular resistance training can reduce the rate of muscle loss by up to 50%. So it doesn't have to be like in the gym like crazy like you're thinking. Even super light weights, resistance bands can make a huge, huge difference. And the decline in muscle strength really contributes to reduced mobility. It increases your fall risk, and it really overall kind of decreases your quality of life. That's why that's really the thing that we focus on most here. And that has a very close correlation with mobility or your ability to physically move. So those are, I would say, the two major things that we're looking at. So if you have range of motion deficits, that's when we really do more of the hands-on work to try to increase your ability to actively move. But then we need you to strengthen through that range of motion, because if you don't have that strength through the motion, that's when you open yourself up to injury. And that's really when you start to see more of that decline as individuals aren't performing that regular resistance training.
Dr. Dylann, you are getting me even nervous. I mean, I'm over 30 and now I want to run out and get some resistance bands. Resistance bands, is there anything else that our patients could be doing at home to help mitigate this risk and strengthen?
100%. Well, and this is really how I'll say this is, I think that it's super important for everybody to get a custom evaluation. Just like if, you get kind of asked a general question about audiology, hearing and hearing loss, your first response is going to be, this is generally what I would say that you can do, but in each specific person, you're very unique, right? And everyone needs something a little bit different. But if I had to be a little bit general, and yes, resistance band training is really great, but even things that you can use at home that can help improve your mobility. If you have a step or a stair, doing things like step ups, putting your cushion back up against the wall and doing a variation of a wall squat, getting your arms up against the wall and doing a variation maybe of a wall push-up. All of these things require nothing. You literally don't need any equipment. You don't need anything specialized. All you really need is yourself, and you need a little bit of time. So I think that that's the most important thing, is recognizing that you don't have to always go physically somewhere to do it. And anything that you can do will be very helpful for you long term.
Oh yeah, I mean that's very valuable insight, especially for our patients who are older, who really it's hard for them to leave the house. So just things around the house, just utilizing steps, like you said, very interesting. I want to talk about some things that some of our patients hear, right? Tinnitus is a very common symptom of hearing loss. However, sometimes tinnitus is not caused by hearing loss. Sometimes it's caused by somatic things like TMJ. Can you talk about how you treat TMJ in your office?
Absolutely. So this is one of those scenarios where, again, the custom eval is very important to understand. Okay, is this coming from hearing loss, which is really where you will step in, or is this coming from somewhere that is not? So very frequently, I'll have individuals go to see an audiologist, to make sure that the hearing is where it needs to be. If it is, that's typically when they'll come to me, and then I'll say, okay, where else do we need to look? Yes, we have to look at the jaw itself, at the TMJ, which is basically right here. And as you open, close, and deviate from side to side, you'll have motion at that jaw. The other area that's very common that we need to evaluate is what's called the suboccipital region. So if you look just beneath the base of your skull in a kind of wraparound fashion from here to here, very commonly muscular tightness over there can influence the nerves and the nervous system that will move in towards that inner ear. So not only do we see those correlations between whether it's jaw or muscular tightness here, or decreased motion of the jaw that may influence and cause tinnitus, I see so frequently that neck and cervical spine tightness really are a major contributor. And I think that's one of the things that I've seen in such a disproportionate way since the pandemic. So many individuals are more sedentary and at home, more individuals working from home than ever. And so I've been seeing this, evaluating it, and treating it at an increased frequency. So it's a major issue.
Do you feel that these patients with TMJ issues or neck issues, they're complaining of stiffness, pain?
Very, very commonly, it has much more to do with mobility deficits in those areas and tightness, as opposed to like a looseness or too much motion in those areas. I very infrequently see that. So yes, that's when individuals, if they feel an ache, usually if it's the TMJ, they'll describe it almost more like an aching or an inflammation. If the things are coming a little bit more from that suboccipital region I keep pointing to behind the neck, oftentimes they'll describe it a little bit differently. It feels more like a stiffness or a tightness. And again, when they feel tighter, they may have that increased sound or the increased pitch of tinnitus. That's a very common thing, and it'll come in waves.
Okay. All right. So obviously vertigo is another common symptom that we see in our office. Hearing is very important for your balance, right? It helps you increase awareness of where you are in space, how close objects are. However, there are patients, as we get older, the vestibular system becomes more fragile, right? And sometimes they have vertigo symptoms that are provoked by motion. So how do you typically treat these vertigo symptoms in your office?
That's a great question. So essentially, without getting too technical, inside of the inner ear, we have what's known as our vestibular system. That is essentially, it sounds a little bit funny and like some voodoo, but there are these small crystals basically that sit within 3 semicircular shaped canals. So basically, there's one that's more vertical, one that's more horizontal, and one that's a little bit more on the diagonal fashion. So if individuals are experiencing vertigo, one of the first things that we do is do an assessment where we'll kind of position you in a specific location or in a specific way to see if that elicits or reproduces any of the symptoms. The most common form of vertigo that we see, and I'm sure the most common form of vertigo that you would see in your clientele, is called BPPV. So it's benign paroxysmal positional vertigo. And that is the most common, where some of those small crystals in the inner ear will become dislodged. They won't sit in the regular resting position, floating in the fluid in the inner ear that they should. As an individual may roll in bed or do a different movement, some of those crystals can actually get stuck in the incorrect canal. So as you're evaluating, based on the findings that you see in the evaluation, sometimes it's the direction of eye movement that you may elicit, or the presence of elicitation of symptoms, right? Sometimes you'll feel a little bit like the room is spinning. That's how we know if that's what we're dealing with, or if this is something else. So that custom evaluation is so important. And weirdly, for BPPV, the treatment sometimes is very simple. So there are things interventionally that we can do. The most common one is called the Epley maneuver, which I'm sure you're very familiar with. And that is basically for like the most common form, there are a few other forms of treatment that you can also do based off of your evaluative findings. And this, to me, really, when I think about the collaboration between audiology and physical therapy, our balance is regulated by these three systems, right? Our visual system, our proprioceptive system, which has a lot to do with our muscles and our joints, and this vestibular system in the inner ear. Since this hearing and balance are so closely linked, like this is really why collaborating between us is really essential for kind of comprehensive care for elderly individuals.
Oh yeah, I mean, first of all, I can't tell you how many patients feel like they just have to live with their vertigo symptoms. They don't even realize that a lot of these cases can be resolved, just like you said, with a simple maneuver or just a more intensive care strategy. And so much about what me and you do as audiologists and physical therapists is keeping our patients upright and reducing their risk of falling, because one wrong fall, you're at a loss of independence completely and quality of life. So thank you so much for joining me today. Physical therapists play such an important role in making sure people enjoy their remaining years and enjoy their life and improve their quality of life. So thank you so much, Dr. Dylann. And we definitely have to have you back on.
I appreciate you, Dr. Rubin. This was so much fun. Again, anybody who needs any type of custom evaluations or even just wants to reach out, have a chat, and understand a little bit more about what we do in the office, feel free to reach out. For Impact Physical Therapy in Flatiron District in Manhattan. This was so much fun. Thank you so much for having us.
Yeah, you're right in Manhattan, a couple of subway stops away from Brooklyn Heights. And if you need anything or want to talk again, I'd happily get you back on. This was very informative, and I know our patients will really enjoy this.
Have a great day.
You too. Enjoy.